what is like the main reason that men come for penis enhancements?
That's a good question. I think most of the guys come just because it's not like lack of confidence or anything like that. It's mostly just that they're curious, they want to have fun. Maybe their wife had some sort of procedure. I think it's analogous to kind of why women do breast implants.
Mm.
It's not necessarily there's something wrong. It's just they always were wondering what would it be like if they had bigger breasts, and so they go get it done. And a lot of times it's the same with the guys. Like I said, very common that their partner actually had something done, and they kind of figured it was their turn.
Hmm. And so you had a like you didn't start off in this career in the beginning. You used to be a consultant, and then you moved later on into this career. So how does someone become involved in this kind of industry?
Um, so I started with management consulting back in the 90s.
Yeah.
I quit that job in early 2000s, right around the kind of tech bubble boom burst. Um, so at that point, I decided to go to medical school. I did the normal thing. I ended up training in anesthesiology. So I
Hmm.
am an anesthesiologist. I still do anesthesiology. I work about 1 or 2 days a week in the operating room doing normal type doctor stuff. How I got into this was I had been looking into finding some sort of cosmetic work to do as a lot of doctors are doing, they're trying to get out of just routine kind of insurance based medicine and
Yep.
trying to do something different, maybe to supplement their income or because it's more exciting or just out of curiosity or whatever. And I ended up going down the process of I was originally trying to do hair transplants, and I met some people and kind of went down that path. And then I happened to have a friend who had a brother that lived in Sacramento who was a cosmetic surgeon. Um, I met with him. I had then at the same time met some people that had told me about this procedure that I'd never heard of penile enlargement before. Just like I'm sure most listeners here have never heard of that.
Yeah.
So anyway, someone told me about it, and then because I knew the brother of my friend that was a cosmetic surgeon, it just kind of all fell into place. I had an office to work out of, and he's actually my business partner now. So we're both co-owners of UpSize.
Hmm.
Oh,
And
wow.
can you tell us more about this procedure? Like, what's the process? How does it work?
Yeah. Um, the so from start to finish, usually people find us through some sort of marketing, or they're just curious and maybe
Yeah.
Google something, and then we most people have a discussion on the phone with one of our employees that answers the phones and emails and all that kind of stuff, and so they're pretty good about explaining the procedure and what to expect and what are reasonable expectations and all that. So that's the beginning process. Then they if it's looks like it's a good fit for them, they book an appointment with me or one of the other 20 offices that there are. I think there's actually 25 offices now.
Nice.
And so they'll meet with the doctor there. That meeting takes 20 minutes or so just to go over the medical history, maybe explain some more things, go over the risks and benefits, and then kind of come up with a plan. The procedure takes about 40 minutes. It could be a little more, could be a little less. It basically involves some injections for numbing.
Mm.
And after that, we use what's called an aesthetic microcannula. So that's like a very thin long needle, but that's dull. And so the needle kind of, once it goes underneath the skin, because it's dull, it can't really cause any, or it's very unlikely for it to cause any damage to anything underneath the skin. So that's why we use that. So through that, we inject dermal filler, which is the stuff we use is made of hyaluronic acid, which is the same type of filler that you'll see put in lips or cheeks, just all over the face.
Okay.
And the reason we use that is because it's otherwise a naturally occurring substance in your body. So, anyways, we inject that in. We kind of form everything to make sure it looks right, and then we send them home with dressing on. There's not really any restrictions after, except for no sex. So I made it sound like a really long process, but actually it's like an hour start to finish, or maybe
Oh,
an hour and
wow.
a half.
Okay.
Is
I
there any
mean,
benefit to having a circumcised versus uncircumcised penis?
There is like a slight benefit. It's possible to do the procedure either way. And I would say like 40% of our patients are not circumcised. Technically, it's a little bit easier to do if you are circumcised. And the other thing we find is that if people are circumcised, then they get a little bit of added length also from the procedure. So, backing up a bit, the main goal of the procedure is thickness. It's almost impossible to actually lengthen the penis, so we're only talking about thickness.
Mm.
But if you're circumcised, just anatomically, when you put some filler in there, if you have enough filler, it kind of stretches things out vertically, so you can get an extra 3/4 of an inch or something like that.
Oh,
And
wow.
if you're like uncircumcised, it just goes into the foreskin, so it's you don't actually gain, like the foreskin's mobile enough that it can hold filler, whereas if you don't have foreskin, it just makes your penis longer.
Oh, wow.
okay.
Okay.
So what's like
So
the
that's good
range?
news, right?
Good news.
There,
Good news for everyone.
yeah.
So what's like the usual range that like do you actually have what's the control over how much length people gain, or is it depending on what the client wants?
Well, again, like most of the time, we're talking about thickness or girth.
Yeah.
So we do have control over the amount of girth that someone wants. It's just correlated to the amount of filler we put in. So
Mm,
it's pretty much like a linear relationship. Like if you're starting out at a certain size and we put in, very simply, for example, if your penis had a volume of 20 milliliters and then we put in another 20 milliliters, it would increase in size proportionally. So I think it would double in size, right? Assuming the length
yeah.
stayed the same. And then like I said, you get a little bit of extra length, but that is not as much plannable. It's kind of like either you get length or you don't. But we, because at a certain point, the more and more filler you put in, it gets thicker and thicker, and the length might not change. So you're kind of just
You're stuck with it.
you're kind of like stuck with whatever length you got.
Yeah.
Do you
Stuck
ever
with it. It makes it sound bad.
um so I wanted to talk to you about like people having anxiety about their penis size, like body dysmorphia or such. Like I understand people do it for fun, and that seems like a great thing. If that's something you want to experiment for fun, that sounds good. But if someone comes to you and they're very anxious or nervous, or they have some kind of like traumatic history about maybe when they were little, someone said they had a tiny penis or something, and that carried on. Um, do you guys still like operate, or do you try to do some counseling with them before that, or do you help them understand that if even if they do grow it, it won't necessarily make them happy about it? I don't know.
Yeah, I mean, I can only count on like two hands the amount of times that someone's come in and I thought they they were doing it for the wrong reason or whatever,
Mm,
and with the wrong reason being that they think it's going to solve some problem in their life, right? Because you can, I mean, you can be like insecure about the size and get it done, and then it solves that problem, right? Like,
Mm-hmm.
but if it's that you think that your entire like level of success and relationships and all that is like due to your penis, then probably it's not good for you. So I've definitely had a handful of people that have come in, and I will tell them like, you know, if you want a bigger penis, we can do that, but it is not going to solve your like marital problem and the fact that, you know, this and that. So I feel like there's not been a scenario where I felt like it was unethical to do the procedure or it wasn't a good idea. It's like, you know, as long as they know what it is and as long as I'm upfront with it, then that's fine. But yes, you're right. Is like, it's not going to cure your anxiety or depression. And remember, like people could have like various reasons for wanting it done, right? Like someone could feel like it's like harming their relationship that it's too small and maybe that's not true, but they still want a
Mm-hmm.
bigger penis, right? So then
Mm-hmm.
you can still make it bigger, right?
Yeah.
Yeah.
Um, I think like the anxiety that comes with it, like the body dysmorphia, I think that's a bit of a tricky situation because we all have our own anxieties and insecurities about our body, and of course, we want to work on it to make it better. But I think with like social media, we're getting like unrealistic expectations sometimes, and um, yeah, I think it's important with when people do go through these procedures that they have kind of like realistic expectations. They don't think that this is gonna solve all my problems, and yeah, they have realism about what it's actually gonna look like. You guys show them like photos of what it might look like afterwards, before and after.
Can you?
Do you guys
Oh,
show
I do.
photos?
Yeah, I thought you were
Yeah.
wondering if you can. I'm like, go ahead if you want. So, um, yeah, like we do have before afters. We have I have like probably I don't know 300 of them or something like at the office, but we have a selection of them online. So I would think most people go online and look at stuff before. And I agree with you 100% as far as expectations go. Like you people, and a lot of times these expectation problems are screened before I see them because we have people that answer calls and book appointments and all that. So it's like when you get the guy that calls and he says, "Yeah, I just want to add like 6 or 7 inches onto the length of my penis or something like that." It's like, and like you're laughing, but I get that message every day, right? But we just don't usually see them in the office because once you tell them, like, look, you can maybe get 3/4 of an inch, but if you want thickness, then we can definitely do that. Then a lot of those guys that wanted 7 inches, like we're not going to see that guy, right? That guy was unrealistic right from the start.
Yeah. I mean, like obviously when they see the term penile enhancement, the first thing they're gonna think of is, so, oh, I'm gonna extend this.
Yeah,
And then they find out the procedure, it's just gonna not work out.
yeah.
I
I
did want to
mean,
ask. Oh, sorry. Go ahead.
no. I was going to say, just from an anatomical perspective, like people need to think about this. If you want to lengthen a part of your body, just think of any part of your body. Like think of what that would entail, right? Like you want to lengthen your arm, like how are you going to do that, right?
Yeah.
You'd have to cut it in half. You'd have to like add on bone and muscle and tendons and ligaments and like nerves, like more skin. Like it's basically impossible.
Yeah.
That's why you don't
Yeah.
see really people getting like being like, yeah, I just want a longer arm, right? You just can't. If you want to make your arm fatter, that's like really easy to do, right? You
Oh
just
wow.
eat a lot of
Mm-hmm.
food.
Yeah. That's
So
true.
that's a good. I think that's a good analogy, and a lot of people I don't know if they're thinking about it simplistically or clearly unrealistically, but or maybe people just want it to be the case, even though it actually doesn't make any sense. So that's something to think about. It's just like an impossible thing to do. But thickness, fortunately, is actually quite beneficial. Most
Mm-hmm.
women, for example, would tell you they do not want a 19-inch penis, but adding like a little bit of thickness onto what you already have would be pretty good.
Okay.
I see.
This is like a fair warning to everyone if they see any ads about extending or making something longer or taller in anything of their body. That's all, like it's all fake ads.
Pretty much.
Yeah.
Hmm. The interesting thing about the penis though is that it's not always the same size. Like it grows, it shrinks. Like that's it kind of maybe gives you the wrong illusion that it maybe can go farther than you
Yeah,
you would know about.
that's kind of a marketing problem that we have
Mm.
because you like, for example, if you're showing, you want to show before after pictures, right? Like as you just said, the penis might be like 3 inches one time and 7 inches another time, right? It just depends on the time of day or whatever. And so I can make it thicker. And so, say you're in the office and it's really warm in there and you're kind of excited and your penis is like 7 inches long, and I take the before picture, and then you come back for the after picture, and maybe it's like a whole 2 inches thicker, but it just looks like it lost an inch and a half now because it's cold in the room, for example. So that makes it actually quite difficult to kind of show people what's actually going on because it's really difficult to get perfect before after pictures.
Hmm.
Why does your penis get affected by the temperature?
It's mostly blood flow.
Mm.
So if you're talking about temperature specifically, when stuff's warm, blood vessels dilate, and the blood flows more, and it just makes it. It's like kind of having like an extremely partial erection. And
I
when it's
see.
cold, everything like shrinks back into the body.
Mm.
Wow. Gotta turn down the AC. Yeah, sounds good.
Yeah, exactly. Like if only I had a perfectly climate controlled.
Have you ever seen anyone do like their own DIY thing on themselves to like what are some things people try to do in order to make the
I've
penis
seen,
bigger?
yeah, like I don't think I've seen it on my own patients, but I have seen it in the hospital, like medically working with urologists, because those people tend to have like more issues. Um, if someone injected a bunch of Vaseline into their penis, like I don't want to see them, right? Like that that's some they can go to their urologist for that. But and that kind of stuff does happen, or people put like marbles and beads in there and stuff. And I know it sounds crazy. Like I'm not sure how, but I think it's common to do like in prison maybe. Um, and then like injecting stuff like Vaseline and silicone and all that. I think people used to do that, or I've seen guys like in the operating room that they I can think of one guy was coming in for a routine urological surgery. I don't know what it was, and the surgeon like cut the penis open to do whatever she was doing, and just like Vaseline was like pouring out of it. And the guy was like 80 years old, so he probably got that put in 50 years ago, right? And it was just like sitting in there.
Wow.
Wow. 50 years of
Yeah, it's
Vaseline
crazy,
just,
right?
oh my God. And he doesn't feel it. Like he doesn't sense it or throughout
He
time during
probably
the
doesn't even
morning.
remember he got to put in, right? It was like so long ago.
Oh my God. So, like, what are some of the weirdest questions you've had from patients?
The weirdest questions. I got a email, like I got a email, I think the other day, and the guy, or I think I saw a text message. Like I don't respond to texts anymore, but they all kind of come
Okay.
through my phone. So sometimes like something will come and it catches my eye. And he wanted the person, they'll say, okay, can you send me before after, right? So it's like they send them to a website and say, okay, here's
Yeah.
before, here's after, and there's an erect one even on the website, or there's a couple. And then the guy said he wants one. Do you have one of it like penetrating a vagina? And I was like, I told the person, just like, cut this guy off. Just you can stop texting him.
Oh my God.
That's a different website.
I mean, being in this industry, like, obviously the sky's the limit on all kinds of crazy stuff I could see or hear.
Yeah.
Honestly, like, most of the guys that I see in the office, I will say this, by the time you're like an appropriate patient that has reasonable expectations, is,
Yeah.
can afford it, like lives in San Francisco or wherever the office is, that person that comes in my office is almost always like totally normal, like reasonable person. It's just that when you have a website that has like whatever, thousands of visits a day from random people, then the sky's the limit on what kind of crazy messages you can get.
Yeah, you're definitely gonna be exposed to a bunch of weirdos. I mean, that's the internet for you.
Yeah,
But
exactly.
what about in real life? Like, for example, when you're having a social interaction and you're talking about your job with someone, um, how do you explain that to a person, or like how what are people's reactions when they know what you do or what you work on?
So if I am to like, it depends, right? I have the luxury of being able to either tell someone I'm just a doctor and then it stops at that, or
Yeah.
I'm an anesthesiologist, or I just outright say I'm a dick doctor, right? So I have three
Yeah.
options. Um, and I kind of use those different options strategically, right? Like
Yeah.
if I'm meeting like, someone's grandmother, like maybe I'm not going to start with I'm the dick doctor, just like I'm an anesthesiologist. But a lot of times it's when it is the right. I mean, most people I'm fine with telling them, and it's usually just a fun conversation, right? Like most adults that find that out, like for example, my son doesn't know I'm a dick doctor, right? He's 6, he just knows I'm a doctor. So there's an example. But
Yeah.
most most adults, like reasonable adults, when they find that out, it's like it's a good story, right? It's like you can laugh about that, and I've got good stories, and it's interesting.
Yeah. I mean, that definitely it's like there are some people that maybe shouldn't know. Um, like for example, your son shouldn't know probably about that at the moment.
When he's
What
6, yeah.
do
I
you have
hope
a
he
plan
doesn't
for
find
when
out
you want to
until
tell
he's
him?
like 60. Well, I'm just worried, like about how like 7-year-olds are, right? Like what you don't want is like the friends to find, oh, your dad's a dick doctor, right? Like
Yeah.
I feel like that's not the ideal thing. Of course, like all the parents know, right? So it's just like probably a matter of time. Yeah, I was like just an example of I was buying, or I was leasing a car, and you're like sitting at the desk, like talking to the guy or whatever, and they got that room in the back with the glass windows, and you can see the manager and everyone talking. And so I told the guy what I did, and then he was cool, right? That's what I told him, and he went in the back to talk about the deal, and all of a sudden I could see everyone laughing back there, and so I knew exactly that he had told them that I was a doctor that made the dick bigger. So, which is cool. It's like I have a sense of humor. Everyone else does. So
Yeah.
Mhm.
Yeah, exactly. Have you ever got a patient through that? Like maybe you're just having a conversation with someone and saying what you're working on is like, then he just pulls you to the side and says like, "Yo, do you think I can get a card or something?"
I have. I There was one guy that there's a few. There was a guy that I met. Just I'm not going to give away too many details, but
Yeah, yeah.
just a guy I kind of met and became friends with, I guess is the best way to describe it. And
Hmm.
I he knew what I did, and then randomly, like 2 months later, I got a message from him saying, "Hey, are you still doing this thing? Like, what do you think about me stopping by?" And I know my wife, I think twice, has been at like some sort of social event, like, I don't
Yeah.
know, 4th of July party or Halloween party or whatever it is, and had, I think I think there's two people that she's kind of sold it to. Um, I don't go to parties. She's like way cooler than me, so I'm
So
just the guy that'll like. I'd rather babysit and she can go to the party.
fair enough. Yeah. She'll do the
She's
selling
good at
for you.
marketing.
That's
Yeah,
Yeah,
exactly. What are
they
some
they want a woman selling it to them, right? Like no one wants me.
yeah, that's good marketing. Yeah, for sure.
what are some STDs you might see? And do you still operate if someone has an STD?
No, you wouldn't do anything if they have an STD, or at least if you knew they did, right? Like, most STDs are, um, they're what's the word I'm trying to say? They're like latent, right? So people have
Mm,
them, but they're not visible. Most people don't even know they have them. So the one answer to your question is probably a ton of STDs, right? Like you can't see chlamydia, gonorrhea, herpes, and all that stuff.
mm,
You, Genital warts, like all that stuff is usually latent and it's not visible. If you know someone has something, you don't do it. HIV is like, especially in San Francisco, fairly common. Um, not like it's not like every person has it, but 5% of people do, or something like that.
oh
So
wow. Mm-hmm.
again, like I'm selecting for my office is selecting for a certain type of people, right?
Yeah.
Like
Mm-hmm.
someone that, first of all, it's fairly the the percentage of gay patients is higher than the
Oh
regular
wow.
percentage of the population.
Mm-hmm.
So I don't know what the percentage is, but it's probably 20% or something like that. And I would think that's higher than just regular population. And then
Mm-hmm.
HIV is like more prevalent in the gay community, and it's
Mhm.
probably particularly more prominent in San Francisco. So it, I think it in a way selects for that number. Like it's not like 5% of the United States has
Right.
HIV.
Mm-hmm. Um, why is it that you'd see more gay people in your clinic versus straight people?
I think gay people are just more concerned about. Concerned is not the right word. It's like it's. I think it's like almost like a cultural type thing.
Mm,
Like it's just something they care about more.
Mm,
Um, like maybe it's because both sides of the equation have a penis. Maybe
mm-hmm.
like
okay.
I'm just guessing.
Yeah, you
The
can
reality
compare
is like
yourself.
my wife doesn't really care about my penis, right? Like
Mm-hmm.
it's like as long as it's like functionally okay, then it's fine. But like gay guys, maybe it's different, right?
Yeah,
Does it have
totally.
to
You're
do with like
comparing yourself to someone. Yeah,
yeah?
sorry.
And I was gonna ask, does it have to do with like how men in general just always want bigger? Like the bigger car, the bigger house, bigger
Muscles,
money. Everything's bigger
hair.
for them. Everything they want bigger. Yeah,
Yeah,
that's
for
Yeah.
sure. I mean, I think that's true. There's various reasons why people come, but what you're saying is true, and that's certainly a lot of guys. Like I said at the beginning, most guys are just doing it for fun or for curiosity or because
mm,
they thought about, it's just like, oh, I can have a bigger dick. Like, awesome, let's do that, right?
yeah. Why not?
I think that's the most common reason.
And
So yeah, it's
you
just
said
like
the
getting a bigger house or a bigger car.
yeah is and you said the process
They
was like
probably
just like
all
a
get
one.
all three, by the way.
Sorry, what?
No, I said they probably get all three if money's not an issue.
Might
Yeah,
as well.
true. Um, and the process takes only like 1 hour, right? is there like anything that they have to do later on? Is there like checkups or things that they have to consistently do to keep that size, or is it just like a one-time thing and that's it?
Well, the filler that we put in lasts about 2 years on average, so they would usually have to come back if they want to keep that size. Um, so most guys come back like in some amount of time. Either they come back when it starts wearing off, or they come back just because they're like almost addicted and just want more. Right?
Mm.
Like I have a lot of
Yeah.
patients that they, especially if money's not like super tight, then they see it's bigger and they're like, oh, that's awesome, but I want more now, right? And then they just come back for more. But if that's not the case, it would be like 2 years or so that you would come back. So that's one thing. As far as like directly aftercare, there's not that much to it. Basic things like just like if you have any procedure, it's like don't, you know, go in a hot tub that night. You don't want to get an infection or whatever.
Mhm.
Don't
Yeah.
maybe we tell people not to have sex for a week, just to try to prevent infection. But that's about it. It's like guys literally will come at their lunch break and have it done and go back to work. So it's that benign.
Yeah, fair enough. If it can be done like that quick, yeah.
Right.
Damn.
There I have
Um,
one guy, he's funny. He's like he sells like, again, I don't want to say what he sells, but he's a salesperson, and I've seen him a handful of times, and every time he comes in, he's like on the phone, like with his salespeople, like selling stuff to like clients, and the salespeople just like working deals on the phone while I'm doing the procedure, which is like pretty hilarious.
that is yeah, that's definitely like a weird situation to be in. Like he's just to picture it in your head, you're just like, what the fuck is going on?
It's funny,
But I
right? I
guess
mean,
when
I
you're
just
working,
like, and I'm the first one to tell him, like, when we're done, that's hilarious.
um,
Does the procedure hurt? Is there? Do you have to
Not
give them
really.
anesthesia?
There's numbing, so numbing can hurt a little
Mm.
bit when it goes in, but after that, they don't feel anything. The numbing's really effective in this case.
And
mhm,
are there any other cons to this procedure? Is it
Well,
expensive?
any medical procedure has risks. The risks in this one happen to be pretty low, but there still are risks, right? There's a chance of infection, there's a chance of
Hmm.
damaging things or structures. There's a chance of it not giving you the result that you want. Maybe a chance that the filler doesn't last as long as you want, things like that. Infection risk, maybe like 1 in 100 chance or something like that. And those infections are usually skin infections that just go away with antibiotics. So not a big
Hmm.
deal. When you put a needle in something, you could damage it. I personally have done over 1,000 procedures, never damaged anything. So it's very safe on that. From that perspective, I've never had an allergy to anything. It's mostly because what we use is like naturally found in the body, anyways.
mhm,
So every now and then, someone isn't super happy. I would say maybe 1 out of 50 people is like, hey, can we fix this or something? But again, it's fixable. It's not like you do it and then they're just stuck with
Oh
that
wow!
forever.
So you can undo the procedure a little bit too.
Yeah, you can dissolve
Mm.
filler. So if you put it in a place and they don't like it there, it can be dissolved. If there's like, say they're like, oh, there's a little lump here or something, you can dissolve that. So those are like I said, not like super uncommon, but not a big deal. And
mhm.
and the other thing is, it's expensive to do the procedure. So I would, in a way, say that's the biggest downside kind of thing,
Hmm.
right? Um, for certain people, it's just not even, it's a non-starter. They just can't, and that's fine. And for certain people, it's within their budget, but they have a budget, and that's fine too. That's like a lot of our patients, and that's just like anything in life. And then there's people where it just doesn't matter, and they can, the money's like literally not an issue, and they leave your office in a Lamborghini, right? So,
Mm-hmm. Yeah.
which I've seen numerous times.
Big car.
That's
Yeah.
Yeah.
that's the one who's closing deals while he's getting operated on.
Yeah, I actually, yeah, I don't know what that's like. But it's like you also learn like how much money there is in certain industries like that I didn't know, right? Like
Mm-hmm.
I had no idea that someone who sells like a particular thing could make like, $1 million a year or whatever. But apparently they can, right? So you learn a lot about people when you're a doctor.
Oh wow.
Maybe you can give us the inside scoop off record.
Yeah, I mean, there's like, it's like anything you do, you're like, oh, I should have gone into that, right? Like, why am I?
What's like the minimum age for someone to be able to do this operation?
I think technically it's 18. It might be different in different states, but in California, at least it's 18. Youngest person I've done is 19.
Okay.
Most guys are like 25 or older, and that's mostly just like a financial thing, I think.
Mm.
It's just like, it's not very likely you have, $6,000 or $7,000 lying around if you're 22 years old. At least,
Yeah.
I was like a successful 22-year-old, and I still didn't have that lying around. So,
Yeah.
I just think it's unlikely. Although with like crypto and stuff like that, there's exceptions.
Um, so what advice would you give to people who are below the required age who maybe have thought of this or are considering it, or like would you tell them it's worth it, or maybe don't think about it too soon, or don't worry? Like, what kind of advice would you give people that are younger than
Yeah, I
you?
mean, if you're under 18, even if you are 18, like you've got more important things to worry about in life than
Mm.
the size of your penis. Like if you're, now to be clear, there are medical issues that are like things like micro penis where it's
Hmm.
beyond my scope, and you should see a urologist or a plastic surgeon, and those people probably have already, right, by the time they're 18. So that's a different story. But if you're just like a 17-year-old in high school, that's not your problem. Just go have fun and don't worry about that, right? Um, it's really is like with any of these elective medical procedures, it's something you do when you have like disposable income, and you've already gotten a car, and you maybe have gone on vacations and whatever, like then do this kind of stuff. Don't spend your last like $4,000 on it.
Yeah, yeah. I mean, yeah, that's great advice. Hopefully, people are actually taking this into consideration. Um,
Well, if they're 17, they don't have to because they can't get it done anyways. So they'll
yeah,
they can come back when they're 18, and I'll give them the advice.
um,
But
why
fair enough.
why can't you work on a micro penis? You were saying that's something out of your jurisdiction.
well, it like that actually needs to be made longer, right?
Mm.
So it needs like surgery and stuff. And still, I'm not even sure how possible it is. Like I think they have to do some pretty creative things. Because of the same thing we said before, it's like you can't just cut it off and then
Mm-hmm.
graft in things and put it back on. So like I'm not a surgeon, and I'm not doing surgery. I'm just like, the word is enhancement, right? Like I'm
Right.
taking what you have and making it better, but I'm not taking something that like is not functionally good and making it functional.
Mm-hmm.
Mm.
Um. Yeah, that is a difference between the two. What are some things you can do at home naturally in order to enhance your penis? Is there anything, any kind of supplements or foods you should eat, or routine or
Um,
self care? I don't know.
well, no, there's no foods or supplements that are going to do anything. Some of those pills and stuff, usually what they do is they just make things like they work almost like Viagra a little bit and make things just
Mm.
bigger temporarily, but it's not permanent. There's no like pill or anything that you're going to take and then it's just going to give you a bigger penis. The one thing that does work is you could do stretching, um, not like muscle stretching, but like penis stretching. So there's devices you can buy that over time, if they basically apply traction and over time it'll stretch it out. And when you stretch things, you actually get what's called tissue remodeling.
Mm.
And so if you permanently, like if you just apply traction, it's like think of people that gain weight, right? Like their
Mm-hmm.
skin
Yeah.
stretches out and then
Mm.
it doesn't go back, right? It's because that's actually new skin. So it's
Yeah.
just by having constant traction or pressure on something, it'll actually like tissue remodel and you'll get like more penis.
Well, if you're stretching
But
it, would it become thinner?
it might, yeah. So that's where we come in. So you can come in and get filler after that.
You fill in the gaps.
And we
Exactly.
sometimes like we have some things we sell that are stretching devices and stuff. It's like a minor part of my business because it takes a long time. It's not
Yeah.
right. It's not like you just do it for 3 days and then you're good. It's like we're talking about like months or 6 months or a year even of like
Mm.
constant use. But it does work and it's not expensive. Like those devices are $500 or something. So it's definitely an option for people.
What do
Yeah.
you think about? There's so many ads about like chewables or pills or Viagra stuff, Blue Chew stuff that now it's so common all over the internet. Are those like healthy? Are there cons to those too? I know what you're doing is obviously different, but would you
Well,
ever recommend those?
I would not, mostly because they're most certainly don't do what they're saying they'll do. But also because I don't know what's in them, and I'm not sure if anyone really knows what's in them. So, of course, anytime you're taking, like, assuming it does anything at all, right? It has something in it that's like doing something to your body, and
Yeah.
I don't know what
Mm-hmm.
that is, right? So that's number one. Like, there's a good chance that whatever it is not good for you, or we don't know if it's the right concentration or if it was made in like a sterile conditioner, if it's pure, if it's got like impurities in it or what, right? So there's that. And then, but the other thing is just is probably a scam, unless it's claiming something reasonable, right? Like
Mm-hmm.
will increase the vitamin D level in your blood. Like okay, then you can take vitamin D, but if it's just like it's going to give you a 4 inch longer penis, it's a lie. So I wouldn't take it. And then also there's the safety concerns.
Mm-hmm. Yeah, totally. It's like you don't even know what it's in those things, and people are just popping things in order to, get some
Yeah,
effect, and it's so weird. Yeah.
it's so prevalent that everyone think that not everyone, but it's very common that people think that the baseline way to make your penis bigger is to take a pill.
Mm.
Like the message I'll get is, "Oh, is there any way besides pills that I can make my penis bigger?"
Mm.
Like, well,
Yeah.
pills. So is that implying that you think that the pills are a way to make your penis bigger? Because no, not.
It's all bullshit.
Yeah,
Fair.
but like I said,
and
the
Fair.
marketing's out there.
yeah, they have good marketing, and people want it, and people get it, and it's such a yeah, weird thing. I mean, so vitamin D might help. Does like exercise or like natural
No, I just
testosterone
use
also?
vitamin D as a supplement example.
Mm. As an
It's got nothing
example.
to do the penis.
Does like exercise, like general health, also help with penis size, or you
I
wouldn't
mean,
know?
it can't hurt, right? It's like,
Mm-hmm.
doctor, should I do exercise? Like, yeah, you should definitely do exercise, right?
Yeah.
Will make my penis bigger? Well, it's not going to make it smaller. So, yeah.
Unless you're
I'll
taking
Yeah.
tell you what
steroids.
will help. Like, if
Yeah.
you're 20 pounds overweight and you lose 20 pounds, first of all, it will make your penis look bigger because there's less
Mm.
fat around it. And second of all, probably the girls or guys or whoever you're after is going to probably be more interested in you also because you look a lot better. And maybe then the penis is going to be like a little less concerning to you.
Yeah. Fair.
Well,
Yeah.
that's a good one. Side. Anything else?
Um, one last thing I wanted to ask about. So when people lose weight, you're saying that the penis uh, looks better or looks bigger because of the fat deposits. So does the fat deposits around that region kind of like, do they just make it look smaller or do they actually make it smaller?
No, what it'll get is like buried in like, say you have like a lot of fat
Mm.
around like the penis area,
Yeah, like your
like a
thighs and stuff.
fupa, like a fupa. Say you have that, and so like in an extreme scenario, if the fat is like more than the penis, then the penis just is like could be just buried right in there, and it looks like you have none at all.
Okay.
That's an extreme scenario. In most cases, maybe it's just adding like some cushion, half an inch of cushion around there. But if you lose that half an inch, then it just looks like your penis just grew a half an inch. And functionally, it did grow a half an inch, right? Because you have like a half an inch more usable
Oh wow.
space.
hmm
Mm-hmm.
So yeah,
That's
it's all
true.
about functionality in the end.
Yeah, it looks bigger and it's more useful, so it's bigger, right? Even though like the actual like size of if you took a tape measure and
Yeah.
measure the actual penis might not be different, but at that point it's just like semantics.
All right.
Ali,
Well, Said, anything else?
um, that's all for me. I think I've asked all of my penis questions. Um, what about you, Ali? Got anything left?
Yeah. No. Thank you so much, Dr. Joel, for coming on the podcast. Do you want to tell us more about where we can ask you questions or follow up or learn
Yeah.
more about this?
So if you go to our website, it's upsizematters.com. So UPSIZE matters, matters.com. You'll find all kinds of information on there. You can search for an office in your city. You can send us a message. The messages are usually responded to right away, and you just ask whatever question you want, or you can send us an email or give us a call. We'll be happy
Sounds
to
good.
talk to you.
Okay, perfect. And when
Awesome.
do you
Well,
think you're gonna be going to like international? Right now, you said it's just
um,
United
well, we
States.
have 2 places in Canada,
Mm.
and we
Nice.
have one in Panama City that is kind
Cool.
of like an affiliated clinic. And then we have also an affiliated clinic in the UK.
Oh wow. Okay, so it's spreading.
Nice.
Hopefully, one day
Spreading.
we
Yeah.
reach Saudi Arabia, where Said is.
Well, yeah, talk to me offline.
Okay,
Yeah,
sounds good.
sounds
Well,
good.
logging off.
All right.
See you, everyone. Bye bye.